Hello and greetings to everyone. Welcome to our lecture video. Today, we will discuss the last type of personality disorders, which is the cluster C. I hope that you can stick till the end of the video and learn something from this lecture. Without further delay, let us begin. So, cluster C. It is also known as the worried type of personality traits and the most common sin to those who suffer from anxiety disorders. So, if cluster A resembles psychosis and cluster B resembles mood, the cluster C resembles anxiety. So, this type consists of three traits: the dependent type, the obsessive type, and the avoidant type. So, dependent personality. The characteristic features are excessive need of care from others, and it leads to submissive and clinging behavior and fear of separation that starts in early adulthood. So these people, they cannot live on their own and often rely on others for any number of things, including making decisions, taking care of basic responsibilities like work and finances, or starting projects of any kind. So you may also notice that dependent personality disorder, or DPD, and borderline personality disorder, or BPD, both involve interpersonal difficulties and fear of abandonment. But they're different personality disorders. BPD involves extreme mood fluctuations, instability in relationships, and impulsivity. People with BPD have an intense fear of abandonment and have trouble regulating their emotions, especially anger. BPD doesn't typically involve mood fluctuations and impulsivity. People with DPD are typically passive and submissive because they don't want to cause conflict in their relationships. This dependency causes worry and stress on their part. By constantly seeking reassurance from others, and when relationship eventually ends, they often engage in measures to embed themselves in new relationship rather than being alone. So these personality disorder clinical features are as follows. So low self-esteem, doubts about own capabilities leads to avoidance of positions of responsibilities, anxious to assume leadership roles, always agree to those whom they depend and tend to be submissive, passive, and self-sacrificing. They have helpless feeling and fear with break in the dependent relationship. They need to find another person for nurturance and direction, or even prefer abusive relationships rather than being their own. So, what are the management? These people have impaired social and occupational functioning due to the need for supervision that arise from lack of self-confidence. If they lose their dependent relationship, they may develop major depression, but prognosis is often good with the right treatment. Insight-oriented therapies may also help the individual to recognize their strength or abilities. With the support from their therapist, person become independent, and self-reliant. As these people are more prone to suffer from anxiety or depression, anxiolytics and antidepressants will be helpful in their managing of their symptoms. So next, we have the obsessive-compulsive type. The characteristic features of this are extreme orderliness, perfectionism, and interpersonal control rather than openness, flexibility, and efficiency. So this is different from obsessive compulsive disorder, which is characterized by intrusive thoughts that then compel a person to engage in behavior to relieve feelings of distress and anxiety. OCPD does not have this behavior because people with these traits are so fixated with their work, morals, ethics, religious practice, and beliefs to the point they neglect other important things in life like hobbies and social connections. So, in short, this trait can be best understood by looking at the Big Five traits personality, also known as the ocean traits. This is characterized by high consensus and low openness. So as long as you understand this big five personality, which we have discussed in the previous video, all the personality traits that we discussed earlier will naturally fall into place. So what are the clinical features? So the clinical features often involves preoccupation with rules and regulations, orderliness, neatness, and perfectionism. Extreme conscientiousness leads to rigidity and inflexibility. Perfectionism delays task completion. Hard workers with less leisure activities and relationships. They rarely make mistakes and believe that their way is the right one. They put pressure on others to follow right moral principles, rigidity, and stubbornness. They take excess cautions with feeling of excess doubts. So treatment, course of it is unpredictable and variable. Depressive disorders of late onset may occur. These people are often aware of their problems and seek treatment on their own, responds well to psychoanalytic, psychotherapy, group therapy, behavioral therapy are also useful. So in a nutshell, treatment of OCPD is poorly studied, but evidence does exist that suggests cognitive behavioral therapy can lead to less rigidity and reduce both anxiety and depressive symptoms. So the next one, and probably the last of this cluster C type or worried type personality disorder, is the avoidant personality disorder. So the characteristic features are extreme social anxiety with inadequate feelings that leads to social withdrawal. Like schizoid personality disorder, if you could still remember, it is characterized by avoidant of people. So the difference between the two is the avoidant personality disorder desire human contact and relationship, while schizoid personality disorder tends to be alone and don't want anything to do with other people. Instead, people who have avoidant personality disorder avoids people because of crippling self-doubt and fear of disapproval. So clinical features are as follows: poor self-confidence and feelings of inferiority. They often avoid intimate relationship, inhibited behavior, and interpersonal relationship. hypersensitivity to others' opinion, fear of criticism, and rejection. A view of self as inferior is often a common mental trait. Persistent tension and apprehension, social anxiety and social withdrawal. So this personality disorder is commonly seen to those who have social anxiety disorder too, just like we have discussed here. The social anxiety and social withdrawal. Because the core symptoms of both are almost the same, and studies have shown that the comorbidity of between social anxiety and avoidant personality disorder is often 90% or can get as high as 100%. In addition, both disorders not only share the same genetic links, but may even respond to the same types of management, with antidepressant and CBT being effective for both. So, with continuous and compassionate treatment, prognosis is good. Long term psychotherapy is needed because these people distrust others. Therapist has to empathize with the individual and must help him or her to identify the role of inferiority and inadequacy feeling, and it is in connection with social anxiety and social withdrawal. Cognitive behavior therapy will help in changing the distorted thought pattern. Group therapy also will be useful as the person shows some improvement in interaction with others. So always seek support. Don't hesitate to ask for help if you're struggling. It's important to seek support. Don't be afraid to reach out to a friend, family members, adult, or teacher for any assistance. So with that, the last topic is over. We have successfully covered all types of personality disorders listed in the DSM. I hope that you have learned something today, and thank you for watching. And please stay tuned for more lecture videos. Till next time, thanks so much.